Parents as well as educators and staff about returning to school set right now for August the 12th. We'll be addressing certain issues like face masks and social distancing, along with the cafeteria plans and sanitation of the schools as well as transportation. So we're about to join them now as he's going to start here. Baldwin County School Superintendent Eddie Tyler. Let's listen in.
Good morning. I want to welcome our media here today. This is our third press conference in a row, and I will explain some things here, and I'll tell you at the end this will be our last until we come back in August. But thank you, media, for the way you cover us. I appreciate that. We have one of our board members here today. Ms. Lindsay, thank you for being here. Nicole with AEA, and others. Linda Jones with our school system, our nursing supervisor, and I have members of my senior staff up here as well. So there could be some questions that I refer to them. We are opening schools on schedule. Let's start out by saying that. Baldwin County Schools will open August the 12th. We'll welcome teachers on August the 3rd. I have had opportunity to speak with board members. They've talked among themselves a little bit about what might need to happen or not happen. I know we have a board meeting work session tonight. There might be more discussion there. But right now, we're opening schools unless my board gives me further direction. And why are we opening? I believe that reopening schools during this critical COVID-19 pandemic is crucial for many, many families. Families are experiencing additional economic hardship, social isolation by their children, stressors. I received an outpour from parents about stay the course. Our children need to be back in school. And they know the risk. They know the risk. Homeland Security has labeled us, I've said before, as an essential industry. It's essential that our school doors open, not only in Baldwin County, but across the country. Even after opening our virtual schools, we have 85% or more of our parents sending their children to our traditional brick and mortar. I want to remind you again about the risk. When you send your children to traditional school, accept the risk that your child will come in contact with the coronavirus. For those parents concerned about traditional, we offer virtual programs, graded as the best virtual school in the state of Alabama with a grade of A. Right now, as of today, and their numbers might have gone up a little bit, but we have over 3,500 K-12 students enrolled in our virtual school, elementary and middle high school. This will allow us, hopefully, at our brick and mortar schools to create the possibility for more social distancing. What that might look like at any school, I don't know. But I can assure you this, our building administrators and their staff are taking note. They realize that through virtual school numbers increasing, that lessens that number at their brick and mortar, and they're going to do their best, the best they can, to create a little bit more distancing between students. In some areas that might not be possible, but they're going to try their best to create that. We have put to date, we have our CSFO here, we have put to date more than $6 million with additional funding into our virtual school. More than $6 million. That number could go up. I know that John Wilson keeps his finger on that every day. We have opened up over 45 new teaching positions, and they're almost completely filled. This has been made possible, the over $6 million in funding. This has been made possible in the 45 additional units by the taxpayers, by you, and by our board, and by the tourism industry. I'm sure many of you have ventured out and tried to write down some of our beach roads, Gulf Shores and Orange Beach, and tourism is alive and well in Baldwin County. And that is good for the students and employees of Baldwin County. Let's review a few things. We're going to do our best to social distance. Wearing masks, that's not an option. That is from the governor. Wearing masks. And some people didn't like the mask that I had on the last couple of weeks, but I've got me a new mask. So you can see here, we encourage our schools or students to be innovative, but we've also said masks will follow the uniform policy. Nothing I've seen or that would create unrest in our school environment will not be allowed. And I want to say a note about masks. I know I'm going to get those emails again from parents or from dads or moms that like to capitalize the word not and repeat not going to wear a mask. I have a few suggestions. Number one, we have our virtual school. Great virtual school option. Number two, there are other options such as homeschool, and we have wonderful parochial and private schools in the area. So you got that option. But if your child comes to school and refuses to wear a mask, we're not going to take them behind the school. We're going to talk to that child and we're going to talk to you. This is an order of the governor. So masks will be required. They take them off when an essential function is necessary. But also for our special needs students, students with medical conditions, asthma, those type things, yes, we understand that some of these students can't wear a mask. But that will be taken as an IEP, 504, a case-by-case basis. Sanitizing our buildings every day. Every day. We've driven that message home to our principals. They've driven it home to their buildings and grounds manager. So there's going to be staggered custodians. I don't know what that looks like. Hopefully we'll work with our custodians to make it user-friendly to them. Do they clean early in the morning, the whole school, before school opens up? Or after we shut it down? And there will be a shutdown time in the evenings that I'm expecting every principal to do. Will volleyball still be able to practice in the gym? Yes. Will football still be able to come in and go to the locker room? Yes. But as far as the general workings of the school, it will shut down. And we encourage or we'll ask teachers, go home. And that's a tough thing because teachers are there till all hours of the night. Many people in the public don't see that, don't care to know that. But our educators burn the midnight oil as well as in the morning, and they go home to families too. So we will be sanitizing our buildings with the best possible hospital-grade equipment that we have. We have gallons of sanitizers for classrooms. And I told you, I think last week, to me, low-hanging fruit is dry mopping the hall 6 times a day, vacuuming a classroom every day. Now, those are important when things are normal. But right now, what is important to me is the sanitation of our bathrooms constantly during the day. That message has been driven home to our administrators, to our custodians, and keeping our cafeterias as clean as possible between lunch waves and before students come in and after they leave. Our cafeteria staffs do a wonderful job. So I just want to let you know what is important. We've given parents 2 great choices. Traditional school, which we expect to be some of the smallest classes since the 90s because of possible social distancing. The highest ranked virtual school in the state of Alabama. The best in the nation as far as I'm concerned. Partnership with our parents. We're only as strong as our weakest link. Parents, please do not send your child to school if they're sick. You have plenty of opportunity to take sick leave. We have the traditional sick leave, family leave for the federal government, guaranteed 80 hours by the federal government. Every working American has been guaranteed this leave. So please stay home and keep your sick child at home. If anyone in your household has a diagnosed case of coronavirus. Keep your child at home with you. This is what the health and medical community will order of you. We're going to send your child home if we're going to send them home anyway if there's a suspected case of COVID. Distance learning. Distance learning is not virtual school. They're two different things. We have the ability to go straight right away to virtual school through distance learning if our school system shuts down, or if your child has to be isolated at home in some manner, we can go to distance learning. We can close schools. We can go immediately distance learning system-wide, single school, or an individual student who's out sick. The last 6 months have given us the ability to improve our distance learning. And I hear from parents sometimes about they weren't happy with our distance learning in the spring. Sometimes they fail to know that we're obligated by the State Department of Education to implement certain facets of distance learning back in the spring. And in some cases, our hands as the school system were tied. So we did the best we could, turning on a dime. And I hope that parents appreciate that. But we've come a long way. We've learned a lot. Keep your kids at home if they're sick, because we have at-home instruction down packed. We have a new fever policy. Traditionally, I've held kids until they were fever-free for 48 hours. Now we're giving an extra day. Keep them home fever-free for 72 hours, 3 days. If a child comes to school with a fever, they're going home. They will be blocked in our admission system for a minimum of 3 days. So that way we don't lose track of who we're watching over and after. Sick kids at school. We're going to have sick kids at school. Over 50% of our school population comes down with the flu each year. So educators are used to dealing with sickness at school. Our new challenge, deciphering this. Deciphering between sickness and the new COVID. We might be the only school system of our size, so I want to give credit to smaller systems who maybe have this, but of our size, that has a registered nurse, an RN, at every school in our school system. Some have 2. So John Wilson can speak to you to what the state funds. They fund Baldwin County Schools less than 20. But our board has placed an emphasis and a priority on them. We've created isolation rooms where when a student is identified with a fever, they go immediately to the nurse. Then the nurse checks for symptoms. But if the symptoms dictate that possibly there might be some symptoms, then they're put in an area where they're protected. If a student comes and they're sick, then they're with the nurse in the nurse's room. Parents are called on all these occasions. The isolation room won't be scary. It's no different than a typical nursing room, but it'll simply be away from others as best we can. What do we do with a sick kid? We send them to the nurse. I told you about our RNs. These have the skills to assess students. They don't diagnose, they assess. If they're expected of COVID, they will go to one area. If they're suspected of being sick with anything else, they go to the nurse's station. COVID students and employee policy. We have a checklist of symptoms for students and employees. A student or employee identified with 2 or more of these symptoms will be sent home. Students and employees will be sent home being suspected of COVID will not be allowed back in school until they have these items, one of these items. Present a doctor's note clearing them to return to school. Present a negative COVID-19 test result. Remain away from school for 14 days and have been cleared of fever for at least 3 days without medication and improvement of other symptoms. Students will be blocked from returning to school in our attendance system. Students will continue online learning as they are capable through our distance learning system. And parents, all student COVID-related absences will be excused. All employees have sick leave. Family Leave and CARES Act 80-hour leave to cover any absences related to sickness. What are we doing if a class or school is exposed to a person suspected of having or showing COVID symptoms? Nothing more or different than we do now. We're already doing every day. Every day we're treating and sanitizing our schools, expecting we will have COVID exposure there. So every day, just as a preventive, expecting that something could arise, every day our schools, our halls, our classrooms, our cafeterias, our gyms, through all the devices we have, will be sanitized, either starting in the morning before anyone arrives or ending the day when we lock the school up. We will wear masks. And I've told you special needs students and others with medical conditions will be exceptions. We'll have hand washing, sanitizing every day. We have COVID all around us. And I know you know this. I'm not telling you anything you don't know. When you go to the stores and you punch in a keypad, when you go to the gas station, you have all these things all around us every day that you're exposed to. Remember, 80% of our kids and many adults are asymptomatic, meaning they don't show any symptoms. Transparency. We report to parents daily the number of positive tests and diagnosed cases in your school. Remember that. We'll report that daily. We can only do this when notified by the parent or Department of Health. Timing is important. People don't show symptoms for up to 4 days. The results could take 4 days to get back. And notification could be a day or two later. So with that timeline, your child or employee might have been exposed for better than a week. We will not provide any names, classrooms, or personality identifiable information. These updates, they're just numbers, schools, and grade levels. You'll likely know from your kid who went out. We just ask that you be respectful and ask others to be, that you would ask others to be of you. Parents, expect that we will have lots of kids, including yours, going home with COVID. Teacher concerns. Just like parents, teachers are concerned. I'm concerned. I'm not sure that I really wanted to talk about my age, but you're as young as you feel. But as a 45-year educator, not 45 years old, I am in the high-risk category. But I'll be in schools every day. I'll be exposed more than your child probably, or more than our teachers. I'll be going from school to school. So I just want to let you know, we provided the best sanitation, social distancing, mask policies, and preparedness tools and technology as we possibly can. Teachers will get sick, yes, just like students. Some teachers have chosen to retire, about 60 to date. We have had some take a leave of absence, but it hasn't been any more than we have been in the previous years, about 100 since the close of school. We have excellent teachers, and we've been seeking more. Excellent teachers to hire, and we have great success to filling every position. Baldwin County pays their teachers higher than the state matrix. We have the best pay in public school for teachers. Baldwin County has the best tools. Baldwin County has the best quality of life. In respect to my colleagues in this business, I do know that they feel the same way about their school systems. But I'm speaking of Baldwin County Public Schools. We have the best quality of life. We right now have more than 1,500 registered subs on our roll, ready to go. If we can't cover with our subs, then we have flexible options in our schools that our administrators will put into play. Closing schools. We could close schools. We could close one school. We could close a feeder pattern. We could close all schools. But that decision was made in close consultation with health, medical, and government leaders, as well as our 7-member school board. This will be a challenging decision, one that we will not take lightly. I will do whatever is best for our employees, students, and our community, but I will not be, but it will need to be a greater challenge than what we're facing right now. If we close, we will go to distance learning as I outlined. If I will not discuss any specific matrix or which I would judge a closure. I will not get into any coloring patterns beyond what I've said here today. A quick review, and I'll take questions. Parents, keep your sick child at home. If anyone in your house has COVID, keep your child home. Notify the school of any COVID absences. Excuse your child's absences. Report the cases to others. We have a great distance learning program. We have few new fever policy. We have rooms to isolate suspected COVID sickness. We have excellent teachers and plenty of backup. We will notify you of confirmed cases daily. We'll have a plan to close schools and move to distance learning. We have an excellent virtual school option. And virtual school is the same as closing school. I'll be back in August with our final announcements. Remember, teachers come back August 3rd, students August 12th, unless the board deems otherwise. Parents should look for your next communications coming from your principals and teachers. Also, I want to remind the public of our bcbe.org/coronavirus for questions. That's bcbe.org/coronavirus for our frequently asked questions. And I know our media probably has this, but we sent out a notice to parents last night. Our board gets these notices, our latest. We sent it out to our employees. Also, we sent out a little preamble ahead of our Phase 3 reopening. And if I can find it, I want to read real quick. An email I received from a teacher. Good morning, Mr. Tyler. I want to take a moment and thank you for your leadership during this time. I am a newer employee in Baldwin County. I have been so impressed by the leadership and camaraderie within this district. I want to assure you that I'm more than ready to return to work and care for, teach the students that walk into my classroom this year. My job is so important for creating some normalcy for these kids that have had very little normalcy since March. I am choosing faith over fear daily and want to pass on that I am not worried about returning to school. Instead, I am anxious to get back to work and do what God designed me to do. Teach these precious children so they can be successful adults. Thank you again for all you're doing for our district. Baldwin proud. I will take any questions that you might have at this time. All right, we've been pretty thorough, I guess. Guy?
You had mentioned in the previous conferences that y'all have spent about $1 million on disinfectant and equipment and that sort of thing. Have you ordered the masks and things?
Yes, we have our resources. In fact, there might be some information or pictures coming to the media about our warehouse, showing you how our warehouse is slammed full of resources. Some are going out now. Some will be going out once our teachers return on the 3rd. John Wilson might want to speak more to that, to our resources, and then Anthony Sampson with our mask.
I will say that we probably spent close to $3 million on resources, whether that be cleaning supplies. We just put in an order of 1.3 million masks this week that will be available. We have face shields, so we've done everything in our power to make sure that we have the PPE so everyone will feel safe on campus, as well as the appropriate hospital-grade cleaning equipment.
Mr. Sampson, did you want to say anything further about that?
The only additional thing that I would add is that, consistent with what Mr. Tyler and John said, we've also taken into consideration those special needs population in terms of what teachers need to be given and prepared to make sure that they're safe within the classroom. So face shields for teachers as well as face masks for teachers. And if a student has anything that, a specific disability, for example, hearing impaired, if a student is hearing impaired, we've taken into consideration already and been intentional to make sure that they have the proper type of face guard so that they can understand lip reading. So everything that we need to take into consideration for the safety, for the educational environment, we've done that, and we're excited to get started.
So are there any shortages you're dealing with when it comes to the hospital grade type things, or do you feel pretty confident if there is, that they can afford it?
As of right now, we're confident. Our vendors have assured us that these products are available and they'll be in time. They'll probably be in the warehouse next week.
And to that, Marty McRae is our assistant superintendent over secondary schools, athletics, and all warehousing and things. Marty, do you want to say anything else about our resources?
Well, as of now, we'll actually get some pictures out that you can see some of our supplies that we have. We have all our warehouses are full as backups. All our vendors are guaranteed our products, and they'll actually be shipping those straight to our schools. We'll actually be double ordering at the beginning, and then all our warehouses will actually be backups to that. So we'll have our normal supplies, we'll have a backup at school, and then we'll have another backup in our warehouses. So we've got plenty of supplies.
Thank you, Marty.
Mr. Talley, you mentioned, I mean, I've seen like the incrementally people have been signing up for virtual school. We first started talking about this, it was 1,000, then 2,000, now 3,500. And you were talking about the dynamics of then freeing up space. I mean, can you address that perhaps? I mean, how does that look to you when you see that people?
Well, you can imagine that as now over 3,500 have signed up for our virtual school from kindergarten through 12th grade. Well, that's between 10 and 15% of our student population. So you would imagine now, does that vary from region to region in our county? You can imagine that it's greater maybe in some areas. So hopefully in those schools in that feeder pattern, that the principals will take the initiative along with their teachers to see, well, we've got less students in my classroom now. Instead of 25, I might have 16. How can we best social distance? Like I said earlier, the teachers are going to see some of the lowest numbers in their classrooms that we wouldn't normally accept on a normal daily basis, because we got to make sure that we get the most used out of our own in-building teachers. But when they come in, they might have 25 or 28 normally. They might only have 20 or 16. That gives that teacher and that principal the ability to social distance. So we're hopeful that we see that as I move around the county.
Coach, just so I make sure I understood this right, when talking about a student or teacher that may test positive from a class, I think you said really doing nothing different, just sending them to the nurse, home if they, stay at home for 14 days or whatever. What about the contact tracing that would happen? Is that something you're leaving up to the health department? Is that something your nurse is going to handle?
I'll let Anthony address that, but contact tracing he can address.
At this particular time, we have been given no specific guidance from the Department of Public Health as it relates to contact tracing. Our nurses that we have in all of our schools, they're extremely prepared, so they're accustomed to dealing with sick kids, so that when something happens, we have a notification process that Mr. Tyler made mention of, to where we'll maintain transparency and share that information on a daily basis with the public, with the parents, to let you know what is happening in each of your children's school.
And how big a concern is that you don't have that guidance yet? And have you reached out to a specific entity to try to learn more about what you should do?
Clearly, we're always reaching out, but there's some things that are outside of our scope of control. Those things that we can control, we make plans and we make provisions to deal with it and be able to move forward. So at any such time when additional guidance becomes available, we'll adjust accordingly.
And Hal, just in addition to that, we don't want to get too far outside our lanes as a school system and what we can control and govern. So we're constantly in touch with State Department of Education, state health officials. We're listening for things that come out of Montgomery. we're not going to try to jump out ahead of something and then have to back up. We're not going to create more work when we don't need to create that more work. We just wait on direction.
And will this be like a daily email? How are you going to communicate with parents when it comes to keeping?
When there's a diagnosed case in the school, we will communicate that to the parents. It might be on a Tuesday, we've sent something out, notification, school-wide, that there's been a diagnosed case. Might come back on Wednesday, nothing. We send that out. Everything's good today. We will constantly be letting the parents know what's going on, being as transparent as we can.
You mentioned 60 teachers have chosen to retire, I think, which is less than a normal year? Is that what I heard you say?
I think John could address that, Hal, but I think it's close to average, isn't it, John? Yeah, close to average. And the thing about it is, educators being educators, sometimes you might decide not to make that decision until maybe a week before school. You know, there's timelines that the state retirement system sets, but teachers have their reasons for when they go public to their schools about retiring. Some are resigning because they have some concerns or maybe some health issues, or it might just be that they're moving on to another career. We don't know, but pretty much normal.
And are the 45 teachers that you say have already been placed into the new virtual program in addition to replacing the 60 that have retired, or are you still very short of teachers then?
No, we're not short of teachers. The retirees, that's usually, we have state-funded units to where if you retire and you were a math teacher, well, that unit is funded, so they'll just advertise and they'll interview and we'll put another math teacher in there. The 45-plus new teachers are for virtual, and, you know, there could be more, so that's exciting.
You said that students, we might not hear back about a student diagnosis for several days, but that doesn't mean the student is still in the school, does it? You said that if you suspect a student of having the coronavirus, that they would be dismissed from school. Is that, could you walk through that or have somebody walk through how that happens?
Correct. Ms. Sampson, you want to walk through that?
So on any given day, if a student comes to school and they become sick, which students get sick at school every day, I fell, I hurt my arm, I have a fever, our nurses will perform an assessment on those students. After they perform the assessments, clearly we're going to notify parents. Upon parents being notified, parents will be given specific instructions. One, if it's just fever only, we have nursing policies and procedures in place that Mr. Tyler made mention of, where we actually did an increase from our sick stay-at-home provisions with our nursing procedures to increase that, to provide additional time so that students could acclimate, get well, and then be able to safely return to school, while at the same time, through our distance learning protocol, they're able to keep up with their assignments. If a student is suspected where they have fever and additional symptoms, coughing, sneezing, shortness of breath, loss of taste or smell, those students will be subsequently notified along with their parents to stay home. And the provisions that we talked about, where we have the capacity to code those students for excused absences accordingly, we code that within our attendance database, and those students will remain away from school until they bring back those 4 requirements that Mr. Tyler said. Either bring clearance of a doctor's note, free of fever for 72 hours, and that's without taking fever-reducing medication, 14 days, and then we're clearly taking care of an
A negative COVID test.
or negative COVID test. Thank you, Mr. Tyler.
I think you mentioned you will be a nurse at every school, as opposed to perhaps.
Not will be, there are. We've had for a while a nurse at every, you're talking about RNs now. We're not, LPNs are super qualified, good medical folks as far as like our RNs, but our RNs, they're RNs. And some of our schools have more than one RN based on the population. But I said earlier, James and John can speak to numbers, but you know, the state, we're a large system. And I think we're funded less than 20 nurses. John, you can speak to about the state, but our board says we want a nurse in every school.
It's been that way even before the pandemic?
Yeah, yes, sir. It's been that way for a while. We have almost 80 nursing professionals throughout the county. The state provides us 16. So we've always taken the next step to make sure we can provide the health needs to every school throughout our campus.
The only thing I'll add to that is that each year, Linda Jones, who's our health services nursing supervisor, she conducts an assessment based on every student's individual healthcare plan needs, and based upon an acuity level, how sick they are, what are their needs, do they need a feeding tube, do they need to be monitored for diabetes or what have you on a daily basis. She performs that assessment, shares that information with the senior staff leadership, and then we in turn make sure that we're there to provide all of those needs. So a school, in a lot of cases, things that students typically 20 years ago would not have been in school for, those students are able to attend school, continue learning because of the nursing services and care that we provide. And we have a nurse that leads, we have 4 team leaders that help manage, write policies, write procedures to make sure students are safe.
Thank you, Ms. Simpson.
If the governor does lift the mandatory mask order, will you lift it as well as school? Will you follow her guidance? How's that?
We have a plan, but right now we're following the governor's orders. We fully expect after the 31st of July that's probably going to continue, but that's just a suspicion. But we've already kind of determined where we might go, and right now we're just following the governor.
Eddie, as a coach, and I'd like to get your reaction, maybe Marty could comment on this afterwards as well, to what we heard come out of the AHSAA meetings yesterday. We expect to hear more today, but it looks like it's business as usual, absolutely no changes from their perspective, basically just throwing it down to you guys to do what you want. What's your reaction to the standpoint or lack thereof that they've taken?
Well, I'm hoping colleges follow suit on Saturdays. Give me something to do on Saturdays to watch college football. But I'm excited about that. I'm excited about volleyball, cross country, football, band. No greater feeling in the world, and I'll speak as a football coach, to be out there in a hot August and you're practicing and sweating, but then on the distant field you hear the band playing. I mean, that just fired me up as a coach, and I made sure our players understood that. But I'll let Marty speak more to anything that he's heard about athletics.
Well, right now, I'm sure you guys have already know about what's going to happen today. It's practice will start next week, as usual. Right now, there's no changes as far as start times with us. After today's conference with Mr. Savarese, with the Athletic Association, we'll meet as a staff to look at some of their recommendations and try to determine what it's going to look like in Baldwin County. So until that time, we're moving forward, and hopefully we can have a good fall season.
Does a band play? I mean, when you look at the brass section, there's a lot of mouth contact with instruments. How is that going to work, or is it going to work at all? Well,
that's why we have good band directors in our system. They make that call. They know what they need to do to protect their students, their band students. Band parents are aware of what's going on in their band program, or they should be, from the band director and the principal. So band directors had a meeting with Mr. McRae, and they were asking for some of my blessings on certain things, like, do we have to travel to all away games? That's a local decision. Do we have to amass our 200-plus member band in the stadium for every game? That's a band decision. I support whatever a band director wants to do. They know best what's best for their program. But the community, the parents, there's so much money invested in band programs, just like there are in cheerleader programs and all the other sport programs. The community is looking for that. They want to hear and see that.
But, you still have the trumpet, and the trombone, and all those things, and the clarinets. There's that mouth contact and close proximity. I mean, I'm sure they've discussed it, but do you know how they can handle it?
I'm expecting them to handle it in the proper manner. I mean, that's why we hire good band directors and good administrators, just like good athletic directors. So the band director knows, am I setting James right 1 foot in front of my tuba? They're going to need to know how to space these band students out, and they might only have to be able to have 50 band members. at a game instead of 150. And they might rotate those. Or they might have half come in first half, let them go and do their thing, and at halftime, third, fourth quarter, bring in the other part of the band. So they've got to be innovative if they want to continue their program, and we hope they do.
You continue to warn, I guess is the best word, warn parents that even though we're opening and doing the best we can to clean regularly, there's that very real chance that your child could come down with COVID. I mean, are you hopeful? Are you surprised? How would you describe the number of people who signed up for virtual? Do you think it's because of all these warnings that you're being given?
I think there's probably a variety of reasons, Hal, and only families can answer that. Some families now have said, hey, this is a great opportunity. I was waiting for my elementary child to be in middle and high school to do virtual, but now I can do virtual now for no other reasons as that program excites them. And then there's those who have concerns, about their child. And I think until those concerns dissolve to some degree, that's where parents want it to be right now until further they can see how things go further.
The only other thing I had was we were talking about the money that you put into the virtual program, $6 million plus, I think you said so far. And you mentioned the reasons you're able to do that. Do you feel fortunate? Do you think that Baldwin County is set up better than most in the state because of those things you mentioned to be able to do that?
Hal, I didn't dream this job, but I'm living a dream. I mean, our board has been very supportive. Our board knows what they need to do to keep this county functioning at a high level. But they've also given me guidance and also given me free rein to make sure that our system is running above average and running well. And if they didn't like that, the board has, they have my contract. But we're fortunate. Yes, we are. We're very fortunate. And here's the thing that I want to make sure people understand. Baldwin County Public School System, if you can give me an idea of what we pull back on, I know systems are closing throughout the state or going to distance learning. Throughout the nation, there's been proration in some school systems. But I want somebody to tell me what the Baldwin County Public School System has pulled back as far as resources, opportunities, jobs, quality education from the students and parents and taxpayers of Baldwin County. Nothing. Nothing. In fact, we're continuing our construction program. It's as good as it's ever been. In fact, all 3 of our new schools just passed substantial completion and all of their things. We're going to try to decide how we do a ribbon cutting in some manner. We do want to do something to acknowledge, because these are 3 brand new ground up schools, and we did the Bamonette ground up last year. So we're excited. Nothing has pulled back.
Have you decided what areas or specific buildings or facilities these new virtual campuses will be? I know you had some areas in mind.
We do. I can refer to Homer or John or Renee. We've identified areas. Of course, you have the Daphne on 4 Lane 98. We have an identified location in Bamonette at the elementary school. Okay. We have an identified location in Foley. We'll get more information on that. And I believe there's another identified location we're setting up in Robertsdale. So there'll be 4 to make it as friendly for parents and students as possible. I think Ms. Lindsay had a question.
I do. Could Hope or Renee, could you go over for everybody out there listening what the distance learning is going to look like if the child is sent home? Just to be a little more clear about it.
Ms. Lindsay asked, what would distance learning look like if a student is at home or a student or the entire system has to close down at some point? So many people are thinking about the spring when they think about distance learning. Things were very different in the spring. We were in a crisis situation and we had guidelines from the State Department, and we were thinking about flexibility for our parents because we did not know if they would be dealing with job loss. So we made some very different decisions in the spring for enrichment and practice. It will be very different in the fall. We've had our teachers training the entire summer through virtual trainings that our IT department has set up for us. We will have one management system for the entire district that our teachers will be using for assignments and instruction. We will be rolling out that plan Monday with our principals, curriculum leaders, reading specialists, and some assistant principals that in return will train our teachers on our very strategic plan. That plan will include full distance learning, and it will include short time absences at our schools, where we will be working with our students diligently to make sure that we have no gaps with our students in their standards because of COVID. Now we all, we're in education. We have gaps. We deal with gaps academically every day with our students. And we are used to implementing things to close those gaps. But we have a very strategic plan in place. I won't go very detailed at this time because I would like for our principals and teachers to have that training first.
Hope, you want to add anything to that? Or?
And we have been bringing you coverage of the Baldwin County Schools Superintendent Eddie Tyler, bringing everyone up to date about plans to reopen the schools during this period of COVID-19. As you heard, schools will be opening again on August the 12th. Meantime, the teachers will be returning on August the 3rd, preparing things unless, as Superintendent Tyler said, the board gives other directions. Of course, they, as mentioned, are continuing to monitor what's going on from the health department perspective with the different numbers of cases as well as deaths in our counties here along the coast. Now, he mentioned that they are opening because a lot of comments from parents wanting their kids to go back to school. Some 85%, they say, of parents are sending their children back to the traditional classroom setting. Now, they do and are warning parents to expect some risk due to this of the COVID-19. But they also mentioned that right now about 10 to 15% of the student body are going to attend the virtual schools. That's about 3,500 right now already enrolled. Now, they said they have also invested some $6 million into the virtual schools, and they've learned a lot since what happened earlier this year when schools were let out early due to COVID-19. And they say that it will be a definitely different experience for students, a much better one. They've hired 45 new teachers for that as well. They talked about with the virtual school numbers that will allow more opportunity for social distancing in the classrooms due to about 10 to 15% of students at home during the virtual schooling. Now, one of the things they want to require, and remember that social distancing is required as well as mask. The mask, not an option in Baldwin County schools, and that's by order of the governor, and of course also what they are following due to different policies. They recommend also not to be using certain types of masks. So a very good piece of information for all parents in Baldwin County. This will be available on our Fox 10 YouTube channel. If you want to go back, if you missed some of this and want to hear this again, some great information to be prepared and so much to share. So definitely do that if you have the opportunity, the Fox 10 News YouTube channel, where you can hear all of this great information once again. Schools opening on August the 12th in Baldwin County. I'm Eric Reynolds. We'll have more on this for you later today at 4 p.m. and 5 p.m. here on Fox 10 News. Have a great afternoon.